How we plan a corrective or a repair hair transplant when a patient has already undergone one hair transplant previously. This video is going to be a detailed step-by-step discussion of how we plan these surgeries, which are a bit complicated, especially if the grade of baldness is high. Suppose it's a Norwood 7 grade where we have to do almost around 6,000 grafts and the donor site is already being used once, and along with that there is some medical risk associated with the procedure, as the patient who is undergoing this procedure is having some risk factors which we as a hair transplant doctor have to keep in mind. And this video is just not about the science of this, it is about the trust which a patient puts in us whenever they are choosing us for their repair hair transplant. So it's a trust, it's a planning, it's a science, the entire gamut of the things on the decision making. Even if there is one mistake in the entire planning and its execution, it's going to be again a failed hair transplant. So let's start this video. So friends, let me introduce myself. Before actually starting this, I am Dr. Satya Saraswat. I am a gold medalist plastic and cosmetic surgeon based out in Agra, India, and I have been a member of International Society of Hair Restoration Surgery and a fellow of ISHRS, FISHRS, certified board member of American Board of Hair Restoration Surgery, as well as various other national and international organizations related to plastic cosmetic surgery as well as hair transplant. We are working in the field of hair transplant and hair loss since 2006, and we have helped thousands of patients regaining their hairs as well as their trust and confidence back, and we are training a lot of doctors in this field as well. We have trained almost around 100 doctors in the field of hair transplant. If you are planning a hair transplant for yourself and you want to know the scientific facts behind it, I would request you to subscribe to this channel. So this patient, he came from UK and he was around 62 years old. He had already undergone one transplant couple of years back, but his results were suboptimal. Things which he told us at the time of consultation, which we did a few online consultations as well before actually he came to India, was that when he was undergoing the procedure, he got to know about some stressful personal news regarding his family member, the ill health of that family member, and that made him a bit jittery. His blood pressure shot up. Then he could feel some pain, his bleeding increased during the first procedure, and that overall stressful scenario of his first surgery, in which he was transplanted around 2,000 to 2,500 grafts. He did not know the exact numbers at the time, but ultimate outcome of that transplant was slightly unnatural straight hairline and poor growth of the transplanted hairs, and this caused him a lot of distress. And when the results were sort of finalizing after 8 to 10 months or 1 year, he started researching how to improve upon these kind of results. As per his own submissions, he said that he screened over 100 clinics worldwide and even took consultations from around 10 of them, and one of them was us. He said that he felt comfortable talking to us and we addressed all his concerns in detail. We will be coming out with another video of this patient where he speaks to you directly about his entire experience when he connected with us in online as well as in person. When he came to us, he had modest expectations. He shared his complete medical information with us. He was on antihypertensives, that was some medicines which were controlling the blood pressure. He wanted to get whatever improvement he could from his resources, that is the scalp and the beard. So as the first step, we assessed his scalp overview kind of thing, and we found out that his was a Norwood 7 grade. Few sparsely placed hairs were there with a very low density there. Unfortunately, he was not prescribed the medicines also to take control of the previously transplanted hair as well. And we took his vitals. He had some safety concerns which we discussed. We took his blood pressure, which was almost in the range, and he had before coming to us shared his readings of the blood pressure for last many weeks, and they were all under control. So as the first step, we did his trichoscopy. So friends, by now you must be knowing that trichoscopy is a evaluation method to evaluate the quality and the quantity of the grafts which are available for the use of the hair transplant doctors from the donor side, and where we are checking out couple of things. First thing is how many of the randomly selected hairs are thicker hairs, the terminal hairs or the anagen hairs, and how many of those hairs are vellus or sort of baby hair, thin hair or the catagen hairs. So his fair skin did not leave too much of scarring in the FUE. We must know that FUE also leaves some microdot scars, so we could not make out by our our naked eye inspection, and since his hair were growing, they were growing long, we could not visualize which parts of the scalp were harvested or over harvested during the first procedure. So to ease out the trichoscopy, we divided his scalp into 10 parts and divided this safe donor area into 1 to 10 different zones, as you can see on the picture here. Now after that, we started doing individual area wise from each of the area 1, 2, 3 and up to 10. We started analyzing the average thickness of hair and the density of the grafts per centimeter square or density of follicular units per centimeter square. What is the average number of hairs per graft or follicular unit in that area? Total available number of follicular units in that particular area and how many we can easily take out from that area. So this took us area by area. This took us around 45 minutes to 1 hour before actually starting the procedure. We called him on the day 1 at around 10 o'clock, but our trichoscopy finished at around 11:30, and you can see on the screen various figures and facts mentioned here. If you are not able to understand any of these data which is given there, please mention in the comment section and we will try to inform you how we came out to that number, what it means. So all this data can be seen on the screen here. So different areas showed us how many grafts we could take out, and this total number along with beard, his beard was very good, and we could easily see that we can reach up to around 6,000 graft mark in his case. After this, we drew a hairline, and this hairline was a pretty standard hairline which we do in our practice, keeping it at around 7 centimeter, not trying to go too low from the already operated hairline and trying to cover the entire scalp, the entire grade 7 baldness. So after drawing the hairline, we measured the entire area by tracing it on a transparent sheet and then sort of juxtaposing it over a graph paper and then counting the number of grafts in each area. So we divided his entire area into 3 parts. One was the hairline of the front, then the mid scalp, and then the crown, as you can see in the pictures here. All these areas were then individually measured in square centimeters, and it was quite a considerable effort to do that. But then this was about the planning of the procedure in the most scientific way. So what we found out that his front was around 71 centimeters square. We planned a density of around 35 follicular units per centimeter square. Then we measured the mid scalp area, and the mid scalp area was around 61 centimeters square. And here we planned a density of around 30 to 35, that is around 32.5 or 32 follicular units per centimeter square. So his requirement was around 1950 graft for the mid scalp area. The crown was 46 centimeters square, and we planned a density of 30 follicular units per centimeter square in this area. So the requirement in the crown was approximately 1400 grafts. So this entire total came out to 5800 grafts for the entire front, mid scalp and the crown area. Please hit the like button if you are liking the planning in which we planned his surgery in this case. Then we did his entire blood investigations at our place, and also we did ECG. Every patient who is hypertensive should undergo his ECG test before actually planning the surgery, and in his ECG we found out that his basal heart rate was quite low. Now this is slightly concerning for us because a low heart rate means that there may be some problems with the heart. But we found out that the medicines which he was taking for blood pressure are not routinely the ones which can cause decrease in the heart rate. Then we consulted a physician about this, and he gave an okay to proceed with the procedure. Then we measured his blood pressure, we did his entire blood test, we did his sensitivity to the local anesthesia as well as the antibiotics which are given before the surgery. So after doing all this, we found out that we were good to go. But the thing was, on the day 1 itself, it took us around 4 hours. So by the time we started the procedure on the first day, it was around 2 o'clock in the afternoon. Now friends, comes the slightly scary part which happened in this case, which was when we started with the actual procedure. Ours is a hospital setting, and we have a continuous monitoring of the heart rate, the blood pressure and oxygen saturation, SpO2 in every case, and continuously. It's not like one time or half an hour or 1 hour, but we have to do it continuously. So while we were giving local anesthesia to this patient, his heart rate suddenly dropped quite substantially low. It came out to around 38 or 39 beats per minute, which is quite low, and it made us a lot anxious. And his blood pressure simultaneously shot up very high from baseline blood pressure of
130 by 90.
approximately shot up to 180 by 120 and even then to 200 by 120, which is very scary for us. So then we gave some medicines to control the blood pressure. And third thing which happened in this patient was his oxygen level started dropping down. Now we'll come to the reasons why this happened, but then we control all this and we started with the slit making. So site creation or slit making was, although his blood parameters, the bleeding time, clotting time, APTT, prothrombin time were all normal, but the bleeding which we faced at the first step of the procedure while making the slits was quite high. I mean, it was approximately double the bleeding which we see in other patients. Then first of all we managed the emergency part and then we did the slits, then we took a break. On the day one we decided to do minimal number of grafts. So the first day number of grafts were around 1300 which we did. We took out the grafts and inserted this. The entire thing, by the time we were finished, it was around 7 o'clock in the evening. Now patient was absolutely fine and the thing settled down after some time itself. But during the procedure we noticed one more thing. When his oxygen saturation came down, he was snoring loudly at the time because there was no pain. So we thought that probably this patient may be having obstructive sleep apnea as well. And when we discussed this, he showed few signs and symptoms which were sort of diagnostic features for that. With all this, we have a suite in our hospital where the patients can stay overnight. One of our staff member was there continuously. We made him relax for that night, gave him everything like food and everything was arranged from the hospital side. Then we planned for next day. Next day, we took the help of our anesthetist in this case, because when the surgeon is more focused on the vital parts, keeping his eye over blood pressure and all these things, his focus gets distracted. And as per the National Medical Council NMC guidelines which came out in September 2022, where they stated that ideally hair transplant should be done in a hospital setting. So in this case, we found out those guidelines to be very, very practical. Next day, we took the help of Dr. Ranveer Tyagi, who is our anesthetist, and by God's grace, he is the president of Indian Society of Critical Care Medicine as well. He comes to give anesthesia to other patients whom we operate under anesthesia, like small kids for whom we do charitable cleft surgeries, and we have done more than 12,000 cleft surgeries in last 18-19 years. So he is our chief anesthetist. So he agreed to be there at the time of local anesthesia, and he did a ECG monitoring also, which is even more accurate than the pulse oximeter. So ECG monitoring was planned, and on the day 2 we again gave, when we were giving the local anesthesia in the portion which was going to be addressed that day, same thing happened again. Blood pressure shot up, heart rate came down. So as per our anesthetist, it was a stress reaction. Patient became extremely stressful when the needles were given, and this probably evoked the same memories which he had in the first surgery. But since he was there, we could do the rest of the graft, 4,500 grafts on that next day, and it was all very, very uneventful. But he was there for initial 1 hour till the time the things started settling down. So in total, we did 5,800 grafts in this patient from the scalp itself, because many of the hairs area, they were very, very high density also. So the distribution of these 1 hair, 2 hair, 3 hair, 4 hair grafts can be seen on the screen, as well as the average number of hairs per graft, and all the other relevant data can be seen. Also, you can see how he looks at the end of the procedure. Now we kept him again on the day 2 itself in overnight at our hospital, monitored him. The recovery was uneventful. Then after that, he went to the hotel where he was staying for another 2-3 days, and then came for the first shampoo, and you can see the pictures there. And he has been sending us pictures regularly from UK, and we can see that the things are being taken care in the best possible way. His scalp looks quite clean, and donor hair also healed very, very nicely. We will be sharing his complete feedback testimonial in the next video, so we request you to watch that video as well, which will be coming out subsequently. If you are planning a failed hair transplant corrective surgery, do WhatsApp your pictures or the relevant information on the numbers which are given on the screen here. If you have found out the information shared on this video to be useful, we request you to share this video with somebody who is actually planning out a repair or a corrective hair transplant after a failed hair transplant. If you want to know the factors which affect the cost of the hair transplant, please click the link given on the left hand side. And if you want to know the step-by-step process of hair transplant, please click the video on the right hand side.